So in this video, I'm going to demonstrate some self-tests and I'll give you the appropriate exercises for the 4 most common shoulder conditions. This will enable you to diagnose your own shoulder pain and to do the proper exercise as well, just from the comfort of your own home. So the 4 conditions I'm going to discuss with you are a radiculopathy, so a pain in the neck leading to a pain in the shoulder, a rotator cuff tear, which could lead to an impingement, a biceps tendinitis, and a shoulder bursitis. Okay, let's get started. So the first cause for your shoulder pain, what we're going to discuss here, could be a radiculopathy. And a radiculopathy is a nerve that exits in the neck and gets pinched in the neck, and then can give you a shoulder pain, but also like a shooting pain down the arm. You could feel some numbness in the arm, maybe some tingling, maybe even some weakness in your hand as well. And it can also give you a pain in the area between your shoulder blades. So a pinched nerve, these yellow things here, what you see here, are the nerves. So this is your spine, this is the back of your skull, your eyes sit at the front here. So these yellow things are the nerves. You can see this gap where they're coming out, that's where the nerve can get pinched and give you those symptoms in your shoulder and then the rest of the arm as well. So when a nerve gets pinched, it's not dissimilar to when you're hitting your funny bone. If you hit your funny bone in your elbow, you don't feel the pain so much in your forearm, but you feel it more in your fingers. That's the same thing when you pinch a nerve in your neck. You don't necessarily have to feel it in your neck, but you could get symptoms down your arm. So the test we're going to do is called the Spurling's test. Now with the Spurling's test, what we're going to do is we're going to try and to aggravate those symptoms a little bit. So what we're going to do with this test is we're going to decrease the space where the nerve comes out to see if we can reproduce those symptoms. It's a super simple test. What you need to do is just stand up. So imagine I've got my shoulder pain in my left shoulder. What I'm going to do is stand up. I'm going to turn my head towards the left, so towards the involved side, yeah? And I'm going to tilt it backwards. That's the second thing, what you need to do. So if this doesn't reproduce the pain, what you need to do is just push your head down a little bit, add a bit of compression to see if this reproduces the pain in your shoulder. So 3 stages: you turn towards the involved side, you tilt your head backwards, and you push down. Now if this gives you the pain, then what you should do is obviously rest your neck, but also apply a bit of traction. And the best thing to do for that is just watch this video here, and that will give you all the right exercises to do to help you with your radiculopathy. So another very common cause for shoulder pain is a rotator cuff tear, which could lead to a shoulder impingement. So the rotator cuff is the name for a group of muscles which surround your shoulder joint and helps to stabilize your shoulder when you're moving it. So symptoms often include a pain on the outside of your shoulder, lateral side of your shoulder. You could also have some pain at night. And lastly, funnily enough, it could hurt lifting something light more than it hurts to lift something heavy. For example, lifting a cup of coffee or a cup of tea could hurt more than lifting something heavy. So that's an indication of a possible rotator cuff tear. So I'm going to demonstrate 5 tests for you. There's 4 rotator cuff muscles, but the first test I'm going to demonstrate to you is a more general test. So the first test is called the Neer's sign. And what you need to do is place the hand next to your body, turn your thumb inwards, and then what you need to do is you lift the arm passively. So what that means is you don't lift the arm itself, but use the other hand to raise the arm all the way up to 180 degrees. Now if this is positive, as in this causes you a pain, then you know somewhere in the rotator cuff you've got an issue, there's a problem with the rotator cuff muscles. So now we're going to see if we can distinguish which muscle actually is causing you the pain. So the first muscle we're going to test is called the supraspinatus. What you need to do is we're going to do a test called the empty can test. So place the hands straight in front of you, turn your thumb down. Now have it go a little bit outwards with the hand, so you have almost like a 30-degree angle with your body. And now what you want to do is with the other hand, I'm going to push this arm down and trying to push this arm up. Yeah, so I'm pushing it down whilst I'm pushing it up at the same time. Now if this gives you a pain, then you have got an irritation in the muscle called the supraspinatus. Now, stick around because I will give you the right exercises for that. So the second test we're going to do is for a muscle called the teres minor, and this is called a Hornblowers test. What you need to do for this one is have a 90-degree angle with your upper arm, with your body, 90-degree angle in your elbow, move your hand a little bit upwards, so in this position here, and all you need to do now is with the other hand is push my hand down while simultaneously I'm trying to push my affected arm backwards. Yeah, so I'm just holding it in the same position. I'm not moving it. It's called the isometric contraction. So you're not moving it, you're pushing it down and resisting it with the affected arm. If this causes you a pain, you might have a problem in a muscle called the teres minor. The third muscle we need to test is called the subscapularis muscle, and we use a test called the bear hug test. So again, my right arm is the affected one. I'm placing my right hand on top of my left shoulder, and all I do now is I push down with my hand on my shoulder, see if this causes a pain in my right shoulder. If it doesn't, we move to the next stage of the test, so we push down, and now my left arm, I'm going to try and push my arm away from my body whilst resisting it with the right arm. So I'm pushing it away whilst my arm is pushing down, so there's no movement actually happening. If this is giving you a pain, causing a pain, you've got a problem in a muscle called the subscapularis. Again, exercises will follow. And the last test we're going to do is a test for a muscle called the infraspinatus, and it's an external rotation test. What you need to do is place your arm on the side here. Now, with this test, you don't actually feel so much pain, rather than you're going to experience a weakness. So you keep your arm 90-degree angle in the elbow, arm alongside yourself. Make sure your elbow is always tucked into your body, and all you do now is you push your arm outwards whilst resisting it with the left arm. So the left arm is going to pull it in, the right arm is going to pull out, but you're resisting it, so essentially no movement happening. So obviously we're looking for a weakness. If you're struggling to keep it and the arm comes in, yeah, so you can't actually hold it, the arm comes in, that might indicate a problem in a muscle called the infraspinatus. Again, a part of the rotator cuff group of muscles, and it can give you the shoulder pain. So some exercises, often, very, very often, it's to do with A, faulty posture, and B, a lack of strength in certain muscles, especially in the area between the shoulder blades. So I've done a video for you, something you could do again at home to help you with these exercises. Watch your posture and do these exercises. I'll link it up here, click on this video here, and it will help you with the problem with your shoulder pain if it's caused by a rotator cuff impingement. So another really common cause for a shoulder pain is a biceps tendinitis. And we all know the biceps is a muscle in the front here of your forearm. Some people have got massive ones, mine unfortunately are not that big. But the biceps essentially has two tendons, a long head and a short head. And it's the long head that often creates the problem. And the long head runs in front of your shoulder to the top, and then suddenly makes a 90-degree angle and attaches into the shoulder joint itself. Now when you have a biceps tendinitis, the shoulder pain typically is located at the front of your shoulder. You might also experience some problems with, for example, biceps curls, pull-ups, especially when your hands, palms are facing towards you and doing pull-ups, and sometimes lifting stuff which is like a little bit away from your body, so you're creating a bit of leverage with the arm. The last thing I've seen, actually quite a few times lately, is people playing tennis might have a bit of an issue when doing the forehand, and they're hitting the ball a little bit in front of them. That sometimes also gives a biceps tendinitis, an irritation of the long head of the biceps tendon. Now, there are two tests you can do for this, the Yergason test and the speed test. The Yergason test is as follows. You make sure you have a 90-degree angle in the elbow, your hand palm meets the face down. Now with your good thumb, what you're doing is you're palpating the front of your shoulder, and then what you do is you rotate your hand, the affected hand, from inside to outside. So my thumb goes from in to out, and you're feeling for pain or sometimes even a clicking sensation you can feel. Now ideally what you want to do is ask your partner or a friend or someone, your roommate, to grab hold of your wrist and give you some resistance whilst you're turning your arm outwards whilst palpating. So some resistance while you're going to the outside, and if that creates the pain in the front of your shoulder, then you do have a biceps tendinitis, and something you can do about it I'll share with you later on in this video. The other test you can do is the speed test, simple test again. What you do is you place the hand alongside your body. Now the hand palm is facing forward. With the other hand, I'm going to add a little bit of pressure to push my right arm backwards, but I am going to lift this arm all the way up to about 90 degrees with a straight elbow. And if this gives you a pain again in the front of your shoulder, that is a positive sign for a biceps tendinitis. So what you can do about it, essentially two things are really good for this. One is cool it with ice. Have an ice cube, take a tea towel, so protect your fingers, get an ice cube and rub it just in front of your shoulder for about 5 minutes every night. Really good thing to do, will reduce the inflammation. The second thing you can do is a little bit of cross friction. The same thing here, what you do is you have a 90-degree angle in the elbow, hand palms, in this case, facing up, and then with your other thumb, you go in the front, you feel where the tender spot is, and all you do now is you move your arm inwards and outwards with the tender spot. Do this 5 minutes, this is called cross friction. Very good exercise to do as well. 5 minutes every night, and this will help with your biceps tendinitis. Make sure that therapy is obviously one thing. Also make sure that you are trying to prevent this from happening again. Often what we see is when people do biceps curls on a machine, what they do is they put the shoulders forward on the biceps curls. That gives you a problem. When you're doing triceps dips, again, shoulders forward. Make sure you stabilize your shoulders nice and back when you're doing these exercises. That will help you preventing to getting this problem in the first place. But these are things you can do for a biceps tendinitis. So the final common cause for a shoulder pain is a shoulder bursitis. Now the shoulder joint is surrounded by bursa, and bursa are essentially sacs filled with fluid, and those sacs help to reduce friction in the shoulder joint itself. So imagine a tendon rubbing over a piece of bone, that would obviously wear out the tendon quite quickly. So if you put a sac of fluid in between, then the tendon rubs over a cushion essentially, and reducing the friction and thereby reducing the wear and tear. But what can happen is these shoulder bursae, they can become inflamed and burst, or inflamed anyway, and that will give you a sudden sharp pain in the shoulder joint. It tends to happen more with young to middle-aged people, not so much the elderly people. They tend to get more maybe calcifications in tendons and more chronic issues, not so much this acute sudden pain, but that's what you're experiencing. So a sharp sudden pain in the shoulder joint. You could have some redness in there as well, maybe you feel some swelling as well, and you also have pain at night. Your movement will be limited. Essentially, often it's movement in all directions. The one test you can do is a painful arc test. So what it means is if you have a shoulder bursitis, you will struggle with this movement. So what we're going to do is moving the arm away from our body, hand palm facing our leg. We're going to move up, and from here, about 70-degree angle, up to here 120 degrees, that's where you feel the most pain. You possibly can't even do it at all. That's called a painful arc, and that's definitely indicative of a shoulder bursitis. So I've done a video for this. It's called Fixed Pinch Nerve in the Shoulder. It's a great video. It gives you 6 or 7 exercises to help with the shoulder bursitis. So if that's what you're struggling from, click on this link and you immediately get some exercises to give you some relief. If you've enjoyed this video and you found it useful, wonder if I could ask a favor in return. Just give me a thumbs up or leave a quick comment in the box down below, or even subscribe to my channel. For now, I'd like to say take care of yourself, take care of someone else please as well if you can, and bye for now. Bye bye.